Ladies and gentlemen, this is so exciting. Look at this packed booth here at M42. I would say we are the most popular booth at all of Arab Health, and I've been here for a full day already, and we're going to be here for another couple of days. A big round of applause to all of you. So wonderful to see you all here. We really are at the nexus of technology, sustainability and health, and M42 is at the forefront of international collaborations and celebrating the amazing talent here. The UAE, it prospers because of its collaborations with the Emirati community here and the international partners represented within the UAE, the region and internationally. And that's what this particular panel discussion really is going to do a deep dive into. My name's Amandeep. It's my pleasure to be your MC over these 4 days here at the Arab Health. And occasionally, they let me moderate a panel or two. This one's a big one, so I'm very excited to speak to the illustrious panelists. Today, we are celebrating building a foundation for precision health. You saw some of my speakers come up earlier for our photo opportunity, but you know what? They're so special. Allow me to introduce them one more time on stage so that we can really get to know them. So, without further ado, I'm going to begin with our very own Ashish Koshy, who is our Group Chief Operating Officer at M42. Please give him a big round of applause. Danielle Shafani, who is the Senior Director of the Broad Institute of MIT and Harvard. Elena Bonfiglioli, who is our Global Business Leader, Healthcare, Pharma and Life Sciences, Microsoft. Dr. Junaid Bajwa, the Chief Medical Scientist, Microsoft. Dr. Mohammed El Haddad, who is the Head of Bariatric and Metabolic Surgery, HealthPoint. Ladies and gentlemen, give our wonderful panelists a big round of applause. Please do take a seat, and I will take my seat over here. Right. There's a mixture of names, but we will play musical chairs and move around if we need to. Ashish, you are sitting closest to me, so it makes good sense for me to begin with you. We've got a really mixed audience here, some expert medical professionals and also a more general audience represented from the UAE and internationally. So let's just take a helicopter view. We're flying over Dubai, we're looking over at the Arab Health exhibition. We do little binoculars down and we see this main stage at M42. We're celebrating this collaboration. Ashish, tell the people in the helicopter, what is this collaboration all about and why is it special?
Thank you. Good afternoon to all. I think just looking at this audience and the diverse friends, family, colleagues, everyone that I see here, it's a privilege to be part of this esteemed panel, as they call it. So really quickly, why is it special? Let me just throw some color into what M42 does. M42 is a large integrated healthcare entity which has healthcare services and also digital technology. Across our services, we are generating data at scale. We have an Omics Center of Excellence, which is supporting the Department of Health in the Emirati Genome Program. We have currently over 100 petabytes of data there. We have a digital health information exchange. We have representatives from the DOH also here. So we have roughly around the entire population, all phenotypical data sets into one central area. We have our hospital data. We have an environmental science data. So across these multimodal data sets, why is today special? I think we are working with great partners to build the foundation of what we want to call our M42 Life Science Platform. The foundation being a trusted research environment, which allows for these multimodal, diverse data sets to be in one platform, providing researchers secure cloud environment access to these data sets to generate insights and hopefully work and impact on personalized medicine and precision health.
Thank you, Ashish. That's a really strong opening for us. That gives us a brilliant insight in terms of M42 and why the collaboration is really special for you. Danielle, to bring you in, Broad Institute of MIT and Harvard, why is this collaboration important for you?
Thank you. The Broad Institute was founded a little over 20 years ago, and it is a nonprofit research institute focused on advancing the field of genomics and how genomics is used for the treatment of human disease. So over the past 15 years, what we've realized is software is a key part in accelerating our ability to extract insights biomedically and apply them towards drug discovery and ultimately clinical trials in precision medicine. So I am here representing software infrastructure that has been built in collaboration with our partners at Microsoft, and the ability for M42 to leverage that to accelerate the deployment of a global life sciences platform.
Fantastic, and that seamlessly, Danielle, brings in our Microsoft representative, Elena, there. You've been building the software in partnership. Tell us about the platform and tell us why it's so special to collaborate with our special partners here today.
Thank you very much. It's an honor and a pleasure. Today is the day in which empowering every researcher, empowering every clinician comes a step closer to the reality of what everyone can access here in UAE. This biomedical platform sets the foundation to do precision discovery and precision health delivery in unprecedented way, from security to ease of use. And that's transformational.
Brilliant, and we're going to get into some of more of those details in terms of exactly what the platform's all about. Dr. Junaid, also from Microsoft as well. Why is this special? Does this happen all the time? In your experience, this top-level collaboration?
Assalamu alaikum, everybody. Delighted to be here. Assalamu alaikum, everybody. Delighted to be here. And thank you again for the opportunity to join. So no, this does not happen every day. I'm a practitioner by background, so a physician in the UK, have the privilege of being Microsoft's Global Chief Medical Scientist on our Microsoft research side. And the exam question that we focus on, and some of our researchers are here within the audience today, is how might we transform the practice of medicine with trusted, reliable, human-centered artificial intelligence? How do we do it in a responsible way, in an ethical way, in an equitable way? And if I think about life sciences, and I spent half a decade within a life science company, a lot of the trials that take place in the world are not representative of people that look like me. They're not representative of my genome, of my phenotype. And we need to do more to break through some of these barriers. We need to do more to tackle the biases that exist. And through partnerships like this, we can fundamentally change how I practice medicine. If partnerships like this lead to a future of precision diagnostics, precision therapeutics, and other capabilities that unlock my potential to deliver better care, that can only be a good thing, and I'm delighted to be here with this team.
And that's such a fascinating point you raised there, Dr. Junaid. You're talking about better representation. So me coming from a media professional background, we're always driven to try to think of the global south and empower voices of the global south. But actually you pinpoint this idea that when it comes to health and data, the global south is massively underrepresented. And this particular collaboration could be a step forward in rectifying that. So wonderful. We're going to continue with that helicopter view there, Dr. Mohammed, because of course, I know we can dive into lots more details with you. You are joining us from Health Point. How powerful is a collaboration like this, and what do you think it could lead to?
Thank you very much, and good afternoon, everybody. This collaboration is like giving a driver a GPS. As simple as that. So when you drive a car, you will know when you start. If you have the GPS, you know where you will start and the speed of the road, and if there is any traffic jam, and when you will arrive. So this collaboration will give us enhanced diagnosis. How do we diagnose? Imagine that we get all the information about the genomics, the microbiome, the imaging, the race, and the high-risk group. Then the diagnosis will be very precise. It's like the GPS. It will tell us when do we start, what we expect on the road, and when will be the finish, and when we'll arrive. This will lead to targeted medicine. What we do right now on daily basis, unfortunately, we try the medications, we try this type of surgery, we try this type of intervention. But with this collaboration, I can tell the patient that with this intervention, I can give you this result, and the probability will be 95% I will reach to that target with this intervention. So this is the future, and this is a dream come true from a healthcare provider. I can look in the patient. What we have right now, we have lots of calculators that can calculate the risk and the results, but I call them two-dimensional. Now we will have 5 dimensions and 3D. So that's the difference.
Wow, that's so powerful. I loved your words there. You said this is a dream come true for the healthcare provider. Now that you don't hear every day. So this really is breaking news. This is groundbreaking and it's innovative. And I loved the fact that Dr. Mohammed took my metaphor of the helicopter and brought it right down to the street, the road. He said, let's do the GPS on the road. So now we're on the road. Now we're doing our journey. We're beginning our journey and finding out. As a reporter, we have some rules. We ask the what. What is this? Let's just address that. So I'm going to come back to you, Ashish. And before I allow Ashish to take the what question here, I just want to plug your article in the National this week here in the UAE that really set the scene. It certainly showed me that there is still a lot of fear when it comes to technology and the healthcare industry, but you provided a very positive mindset that AI and tech can enhance health delivery. So, let's talk about the what and why technology really is the way forward.
So, excellent question, and I think our roadmap and our DNA as a health tech company within M42 is to ensure we use technology to drive decision making, and that's exactly what Doctor has also mentioned here. What the vision is to create that single platform which has aggregated data sets, not just from how, say, the legacy healthcare used to be based on just electronic health records. You have one platform which has electronic health records, has imaging, has genomics, has wearable data sets, a 360-degree view around a patient. Now, is it simple as how I described? No, there's a lot of factors. When you look at from an engineering perspective, there's interoperability of data. How do you ensure these diverse data sets coming from multiple different data sources, you standardize them across and push it into one single platform? How do we ensure that we open these data sets in the right, safe, ethical manner with the regulator to allow researchers not just in the country, but from Abu Dhabi to the world? We are sitting on a large, diverse data set. If we have the right mechanisms in place, as Dr. Junaid said, people like us, we are experimenting on pharmaceutical drugs that was perhaps tested on a different population. We are sitting on this moment where in the UAE, we have 200 different nationalities. If we work collectively, we right now have a platform that can take any sort of data sets into one single platform and ensure that we can scale it with some of our cloud providers here. It's not just on safe and ethical access, but also just scale in terms of any sort of computational resources that you, a researcher or a clinician, would need to drive this sort of initiatives.
That sounds so exciting. It just sounds, and absolutely, as you've really kind of pinpointed those risks that you want to mitigate. You want to be ethical, you want to keep data safe, and the privacy of the patient really at the forefront of your mind. As you said, Ashish, I did ask you to give us that snapshot view of what it is that we're talking about today, and you said it's not simple, but you have made it accessible to us, so I do appreciate that. So Elena, when we talk about developing software of this kind, it's not simple. What goes on in the background to make this?
It is not simple, and yet it's paramount that it is secure. It is paramount that it is privacy enhanced. It's paramount that it is accessible. So when you think about where the helicopter is going on time to drug discovery, on time to identify the right diagnostics, as it has been said. As you do that, you need new tools. You need platform capabilities that allow reasoning over data and genomics, clinical genomics analysis done in easier way. The Broad has an incredible track record in this space. Microsoft has an incredible track record in bringing cloud platform, collaborative spaces, security, and privacy. When you combine all of that with the capabilities that Ashish has mentioned, you have the right recipe for doing medicine in the way in which each of us would want to be treated. Because in the end, you want data to be private, but also to save lives. That's the goal. So when you think about a new biomedicine platform. We'll hear from the broad. But what I think about is a place in which the clinical and genomics data that are there can be activated, can be protected, can be managed, where a researcher can do new collaborations and actually where cohorts can be built to do specific discovery in collaboration with pharma companies, for example, but also in collaboration with providers in the country and the broader ecosystem.
I think that's really exciting, and as you said there's a lot that's going on in order to create this special platform. I'm going to bring in Danielle. I think she's trying to get my attention there. We are talking about the software power that you bring in as Microsoft. When it comes to Broad, tell us a little bit about that.
So when we built the Terra platform, which is a trusted researcher environment framework, fully open source, available to the community, and accessible to global researchers today. When we built it, the goal was always to eliminate medical bias, distribute resources, including software, tools, mechanisms, and data, to the community to help advance global health and precision medicine. So this is essentially a very natural evolution of what our goals have always been. The actual trusted researcher environment, the key to getting that right is balancing, to Elena's point, secure protection of the data, sovereignty of the custodian, right? The groups like M42 who manage the data assets really need to be in full control of how that data is used and who it's shared with. But also the ability for that data to be analyzed in the global context, right? And so that balance between accessibility and security and protection is really where a trusted researcher environment lies. And the collaboration between us here will provide a platform for actually doing that at scale.
And I think the analysis that you share there is really powerful. It really builds on the points that Elena was making. The key words you used, Elena, there was the data to save lives, which brings me on to, having described the what of today, the why we're doing this. I'm going to come back to Dr. Junaid and build on some of the earlier points you made. Now, you see patients, you're on the front line. How useful, how powerful a tool could this be in your toolkit?
So let's maybe think about the road that we're on. So we're helicoptered down to the road. So the context of the world that we live in is we have aging populations across the world with people with multiple complex comorbidities. Many people in this room may be living in knowledge of disease or not living, or living without the knowledge of disease. Many of our parents have multiple diseases that they are managing on a regular basis. At the same time, we also have almost a on-demand need for healthcare. How many people want to wait 1 week, 2 weeks, 3 weeks, 4 weeks for a diagnostic? They don't. But we also have a global shortage of healthcare professionals. So in a panel earlier today, I was discussing that the World Health Organization stipulated that by 2030, the world will have 14 million less doctors, nurses, and pharmacists on the planet than what society would need. 4 years ago, we had a pandemic. It was very surprising that we're all sitting in this room today. 4 years ago, this would have been a dream. I would say that 14 million is much more like 25 million now. If you think about people's changing practices, how many people have left medicine, left nursing, what have you. So we have a supply and demand mismatch. We have increasing complexity of disease. We have not the workforce to manage it. And there you have the innovation opportunity underneath. But could we become a bit more intelligent? So when I'm in clinic on a Friday morning, I see 42 patients a day, 10-minute appointments each. I have 150 letters to review and maybe another 10 to 15 other elements of chaos.
So a light day.
That's a light day. But if you're living in chaos, but you're imagining the future, how do you reduce the delta between imagining the future and then delivery of today? And so if I had better intelligence, if I could anticipate out of the 7,000 patients that I care for, who absolutely needs to come in? Who absolutely do I need to spend more time with versus who could be managed remotely? I could make much better use of resources. If I could also leverage the knowledge of the universe one day and say for the person in front of me, based on their genotype, their phenotype, their electronic records, the data that Ashish was mentioning, if I could almost understand with the knowledge of the universe what treatment lifestyle advice I could offer them, could I offer better care to them and measure that over time and mitigate their risk so that they don't have to end up in hospital unnecessarily, so that actually they can have a longer, more fulfilling life. And that's kind of why I got into medicine in the first place, to be honest. And within that, you end up having to manage the chaos. If we can unlock data for the purposes of public good, I think we'll be on a much better journey for the future.
I think that's such an empowering message, and especially hearing it from you because you are on the front line. And I'm going to bring in your fellow colleague on the front line, Dr. Mohammed from HealthPoint. Earlier you said the words, it's a dream come true for the healthcare provider. Why? Why is it a dream come true, in your opinion?
A great question. So in life, we always learn from experiences, right? And in medicine, as a healthcare provider, we don't want the trial and error. This collaboration would reduce the trial and error. I can sit with the patient and tell the patient, based on this platform, based on all the information we have, based on the database we have, based on the genome, phenotype, and other factors, I can tell you that with this intervention, I can reach to this result. And I want to bring you to another dimension for this collaboration. This collaboration is eco-friendly on individual level and on a public health level. So if I know that with this medication or this intervention, I can reach to that results without trying another medication, I am saving the planet. If I know with this type of surgery, I can reach to this result, then I don't need to try 2 or 3 procedures and use resources from the environment. So this is a very eco-friendly. On the public health level, on the community level, if I know from this collaboration, from this data, that this group is a high-risk group in this area, in this city, then I can go to the public health and try to prevent that even before it happens. And then I will use less resources from the environment and I will be eco-friendly. So this collaboration just makes it so, it has so many dimensions. That's why it's a dream come true.
And so, as you say, sustainability and that eco-friendliness is built into the model. And actually, it can deliver the precision health that we are here to talk about. Because the terminology precision health has a lot of applications, doesn't it? But today we're talking about that particular one. Danielle, I know you want to come in there, so I will allow you to.
Thank you. One of the really brilliant things about M42 and this collaboration that I know we're excited about as the Broad Institute.
Sorry, Danielle, right.
Thank you, sorry. We are very excited, just so you couldn't hear that. We're very excited, but particularly to that point about sustainability that Dr. Mohammed just said, the Emirati Genome Program is designed to support a sequence once, query often approach. And that is brilliant and differentiated, and I think the template for what every biobank should do moving forward globally. And what I mean by that is sequencing is expensive. The cost is going down, but it's still expensive. There are very few people who can do it at scale. But the idea that you sequence participants for a research project and then can go back to actually use that genetic data for clinical care, whether it's for premarital screening or for pharmacogenetics to decide which kind of prescription you're going to prescribe, that model and the ability to use one set of technical infrastructure to support both of those is actually, as intuitive as it is not being done. That is not the standard of care today. And that's very exciting.
And I think it's really good that you point that out, because panels like this make this information really accessible. So it feels like for us, maybe this is happening elsewhere, and why is it not happening elsewhere? So for you, Danielle, to actually emphasize and underline that this is groundbreaking, and as I like to say in reporter speak, breaking news, makes it much more exciting. Elena, you patiently wanted to come in there.
Yeah, I wanted to just build on Danielle's point in the sense that when you think about clinical genomics research and the data sets, often they're not a stable set of data. So what happens is that you end up actually wasting time and resourcing in copying data set or not being able to access, or actually not doing the research because the governance framework is not clear. So we're not allowing the data to speak and to have the function that they need to have for precision medicine. The Terra platform, for the first time, gives rules-based and role-based access. That means me as a researcher, I have clarity on what I can do with that data. Data doesn't have to be copied. And if copied, it can carry, imagine that you carry with it the restrictions that apply. So in a way, you make it privacy-enhanced, seamless use of this data, and you allow these specialists to do their job. And that's core to what we do at Microsoft. We have to empower them. Technology is not about the platform, it's about what can be done with it.
And as you say there, that key word, you empower people who are on the front line. So we know who's involved, we know what's involved and what's being delivered, we know why it's being delivered. Let's talk to Ashish about the how. But before I bring you in, Ashish, we're going to be opening up for audience questions. I promise to make it interactive. Have your thinking caps on. We'll have mics that we can distribute amongst you as well. So Ashish, the how is this happening?
So, excellent question, and that's why we have this panel here. We go back to, we have Microsoft Research. We've been doing this for decades. We've got Azure and Health, represented by Elena, in terms of the solutions that we can immediately tap into what's already developed there. We have Broad Institute. And M42, why I think this combination is, M42 is an organization that has hospitals, we have Omics Center of Excellence, we have Biobank, we have a CRO, we have environmental science. So this sort of combination of having this large, ambitious project taking off has never been done before. And that's why I think we all agree it's exciting for us. And now how?
Can I just say, it's so exciting that the Arab Health have actually put the music up. We're in a blockbuster Hollywood movie, or I should say Bollywood, to represent the global south. So, and they're going to continue.
They changed it, yeah.
I even get some music as well. So I'm just going to need you to get the mic right up there. So super exciting, the how of M42.
Sure. So clearly, as of today, I think we go back to the drawing board and saying, okay, we deploy Terra as a platform, as a trusted research environment. And when we say Terra, it's not just a consolidated data set. It has tools. It has tools where researchers can run complicated analytics. So that's today. You've mentioned the helicopter view and the road. Now, where is the destination? M42 has AI capabilities, which we have worked and we've already deployed here, called Med42. Our vision, I have to be very careful before stakeholders expect this sort of delivery mechanism, but we work on generative AI and we all agree in this panel. Drug discovery is an incredible topic that leveraging these data sets that we have here is a huge area where we all can work together to find maybe targeted molecules there. Second, on what Dr. Mohammed said in the terms of the GPS, leverage NLP and solutions as in Med42 to help clinicians, as you said, give them the right solutions to make decisions and also ensure that they do what they do best, see patients. So that's where we are right now, and the vision is to take this product into be an AI-enabled life science platform, starting off with the Terra platform, but plugging into a modular way multiple new initiatives. We have clinical genomics, we have pharmacogenomics, all in one aggregated platform, and I think that's the key message that we want to share is the vision of this life science platform here.
And I appreciate you sharing that key message because it really is at the heart of what M42 are achieving, especially with their collaborators. I did promise I would open it up to the audience. Please do not be shy. Otherwise, I have many more questions. Oh, brilliant. We've got a gentleman at the front row. Really, my mic? I think you should take the yes, because I like to be in control.
Thank you. My name is Sal Jafar. I'm the CEO of ESG MENA, the first and only ESG Knowledge Hub. My question basically in terms of setting a lexicon, in terms of relaying the technology and what you are revealing today to the rest of the region. I can see that you are bringing the world's best practices from the United States, from the UK. Will you be relaying the same to the rest of the region?
Okay, a really brilliant question. Any particular person wants to take that? Maybe, is that more for Ashish, maybe?
So can you just repeat the question, just to be clear?
From here to the region.
Oh, so okay. So I can answer that question. So clearly, I think in my, one of the statements that I mentioned is, the goal behind this life science platform and deploying the trusted research environment is not only for the UAE. one of the reasons we have to be also cognizant is we are working in a very supportive regulatory environment. The Department of Health, which works with multiple other researchers across the globe. So what we're trying to work is enable them with the right platform, not just for entities and hospitals and clinicians here, but opening it up to the world so that people can access it. So 100% is not just for this region.
Fantastic question. Thank you very much, Ashish. Does anybody else want to jump in there?
I just wanted to mention that the availability of the Terra platform on our global Azure cloud platform is a global availability, is a general global availability. Of course, it also requires, as Ashish mentioned, a regulatory view that brings healthcare to be also cloud first, privacy first, and I would say able to think about how we do things differently. If those conditions are met, then the technology can follow suit.
Okay, that's really interesting. Danielle?
Yeah, a trusted researcher environment is really a platform that manages at least two sides of the healthcare ecosystem, right? Researchers on one side, or users, as well as data managers, owners, custodians. To that end, the platform itself is already global. There are 65,000 users worldwide using it today across a number of hosted data sets. So I think what we're talking about here is supporting a framework where we bring more and more secure data online from the region and beyond.
Fantastic. We are going to see if we've got any more questions from the audience. You're enthusiastic but a little bit shy. We've got a lady here. We might have a very special guest joining us very soon. There may be a pause in our event, but let's take the question and we can pause when we need to pause. So please do hold the mic really high up.
Hi, good afternoon. I'm Lisa, Director of Fatima College of Health Sciences. I'm really curious to get your views on whether you think precision medicine will lead to improved workforce productivity, given the size of the challenge of the workforce shortages we face and the impossible gap that I think will never close just by putting more people in.
Should I give it a go?
Absolutely, go for it.
So I think there's a lot in your question around that too. So when I think about workforce productivity, people are working really hard right now. I think in many health systems across the world, I think people are working at 100, 120% if you take in the goodwill. But could we unlock and make sure that they're working on the things that they really need to? How do you enable people to work at the top of their license? How do you make doctors, nurses, pharmacists go back to enjoying their work again and maybe minimize the mundane? So a lot of the technologies that I'm sure you're aware of, many of the technologies that we're working on, unlock the potential of productivity. And if you think about healthcare on a continuum of risk versus complexity, much of what we focus on is clinical risk patient-facing. The business of healthcare is not all patient-facing work. How do we reduce the bureaucracy and the administration and drive productivity there so we change the work and allow everybody to work at the top of their license? And if we implement it correctly, we'll be able to unlock that massive value for the future too.
Maybe
and to complement,
go ahead.
To complement there is, we see a world in which a co-pilot is a partner to any role, to a researcher or to a chemist to do discovery faster. But we have also seen that just by automating the workflow of the documentation that clinicians do in the pajama time, for example, in the US, we have seen that 40 minutes per day can be saved times number of times. So doing the right things, being focused there, and liberating time to do what matters to save the life of patients. That's the vision that we're here for.
And I think she just stole my answer, exactly that. But I was just trying to bring a shameless product placement. M42 actually does that right now with our physicians, where we can just simplify clinical notes. It's automated, and we can just plug it into the EMR. So it targets the productivity.
We're just going to interrupt our very special panel. And thank you so much for our panelists. I'm just going to give them one last little chance to leave us with a nugget. These are healthcare visionaries. They're at the forefront of technology, meeting sustainability and health. To begin with you, Dr. Mohammed, to begin with.
So I'll give you an example from the real life.
But a very quick example.
So very quick. this platform will be very, very powerful with rare diseases. So we had a patient last month in the clinic with a very rare genetic disease. We didn't know what to do with it because each healthcare provider has seen it once or twice in his life. So we used M42 with the limited information we had. It was so helpful what to do for that patient first, because it was a dilemma which line of treatment you start first. And we did the surgery last week, and the patient did well.
That deserves a round of applause. I love those types of stories, and thank you for insisting on sharing them. As a journalist who believes in the power of stories, thank you so much, Dr. Mohammed. Dr. Junaid, your vision for the future, why will this be saving lives?
So maybe a challenge maybe to the system is, who will be the first country in the world, the first region in the world to do precision medicine at scale? And could it be this region, inshallah?
Inshallah. Elena.
It's difficult. It's difficult because we really have the opportunity to do things different. We have here the commitment, the vision, the tools, and the data sets, and clinicians that already think in the future way. So let's do it. And thank you for making it happen.
Very empowering. Thank you so much, Danielle.
I think about the opportunity for the life sciences in particular. Precision medicine is often synonymous with cancer. I think we have the opportunity to extend precision medicine to common diseases. 40% of every common disease is thought to be related to your genetics in some way. And so being able to bring therapies for common diseases in a niche way, the way that you've seen happening in the cancer field over the past 10 to 15 years, I think this group is well suited to bring that.
Brilliant. I love the fact that you put it in that timeline. Thank you for that. Ashish, I began with you, so I'm going to give you our closing remarks.
No, I'm just going to say, Dr. Junaid, challenge accepted, right? We are in a country which has a motto, impossible is possible. And I think the leadership of the country is supportive, and you could see that on stage. You have every representative of all the regulatory bodies coming here because they believe this team can deliver the true national precision medicine platform. And that's the part I think I'm super excited about.
And we're super excited about this. And as I began today's panel discussion, just giving an insight, I've been based here for over a decade. I've seen for myself that the power of the UAE, the way it is a powerhouse and able to deliver on that challenge there, is because of that collaboration, the amazing Emirati expertise here, collaborating with that international mindset to bring in from the world experts and also share the expertise here with the world as well. So I think that's really important. We want to celebrate everything that M42 is achieving, the UAE, and this international collaboration. Ladies and gentlemen, please give my panelists a huge, huge round of applause. We're going to take a quick photograph, and then we will see you all very shortly for the next session. Thank you.